HSG, the fancy name for that is a hysterosalpingogram test, is a test to evaluate the fallopian tubes, or the connection between the ovaries and the uterus. The fallopian tubes are where fertilization of egg and sperm occur. And so for women or couples who are planning on undergoing inseminations or having intercourse after treatment to become pregnant, we need to ensure that that passageway or the fallopian tube is open so that the egg and sperm can meet normally. So the hysterosalpingogram, or the HSG procedure, is an X-ray test where water-soluble dye is placed inside the uterus through a speculum, and an X-ray is obtained to make sure that dye flows into the fallopian tube and then out the end of the fallopian tube, indicating that it is open. So it is a procedure to test for the patency or the openness of the fallopian tube. So we use, it's a plain X-ray film using something called a C-arm or fluoroscopy that gives us a real-time image of the dye passing through the uterus. So the great news about that procedure is you come in for the procedure, it lasts about 15 minutes, and you get the results the same day. Any woman who would like to evaluate the status of her fallopian tube, or really any woman who is planning on undergoing fertility treatment, should have a test to make sure that their fallopian tube is open. And the reason is that a blockage in the fallopian tube prohibiting the egg and sperm from meeting is one of the most common causes of infertility. So it's important that any couple undergoing infertility treatment understand that their fallopian tubes are open. The exception to that would be couples that absolutely have to have in vitro fertilization for some other reason. Because in vitro fertilization does not involve the fallopian tubes, we do not need to evaluate the status of the fallopian tubes in those women. Certain types of blockages in the fallopian tube are treatable with surgery. However, in an era when IVF is quite successful, it is a decision and a discussion between the woman and her physician, or the couple and their physician, about whether they would like to proceed with surgery to attempt to unblock or surgically correct the fallopian tube, or if they would like to bypass the fallopian tube and have a treatment like in vitro fertilization. And that will depend on many factors. Again, the age of the woman and how much time we have for fertility treatments, as well as other fertility testing. For example, if this couple also had a problem with the male factor infertility and a problem with sperm, that particular couple might be better off having in vitro fertilization rather than trying to surgically correct the fallopian tube. I would say that most couples would prefer to avoid in vitro fertilization because it's a relatively invasive procedure for couples about a very intimate subject. So typically, we do not start with in vitro fertilization as a first-line treatment unless there's a very strong indication to do so, like both fallopian tubes are blocked and not surgically correctable, or there's a significant problem with the sperm, whereas we don't feel the chance of their ability to fertilize an egg without our assistance in the laboratory is possible. So most people would prefer to avoid in vitro fertilization as an initial treatment, but I think the way that we counsel people is that it isn't usually the first treatment of choice for couples with, say, unexplained infertility, but if other less invasive treatments like inseminations or medications to make women ovulate more eggs are unsuccessful, it's a treatment that we have available to us and is quite successful, even when other fertility treatments have previously failed. For certain couples, IVF is the best first-line treatment. Couples that I would say that applies to are especially to women with advancing age. So, for example, women in their 40s who have had infertility and are seeking treatment statistically have the highest chance of being successful in that treatment if they pursue in vitro fertilization. And because age is such an important role in the success of fertility treatments, we wouldn't want to waste too much time trying less invasive therapies, because then if you spend a year with therapies that aren't going to work, by the time you get to in vitro fertilization, your success rate has been affected. So there are other younger couples who have perhaps had some other treatment, and infertility can be a very difficult diagnosis both for the couple, socially and emotionally. And so there are some couples who will look at the success rates of different therapies and state that they want to do in vitro fertilization up front. And I think as well as couples understand the success rates and the chances of lesser therapies, as well as the risks that are associated with in vitro fertilization, that is a perfectly fine decision for individual couples to make depending on their social circumstance.